Hello students, welcome to EPG Pathshala. I am Leena Kashyap. I was the former Deputy Director and Emeritus Professor of the Tata Institute of Social Sciences, Mumbai. Today's subsection is in the course on Fields of Practice in Social Work. I am going to talk about disability studies as a field of practice in social work. That is the subsection I'm going to talk about. Okay. Just now, I'm going to talk about people with disability and their rehabilitation context. Now, let me give you a few facts about disability first. Disability has a global presence. Globally, about 110 million and 190 million people experience significant disabilities. In India, though an official figure is 2.21% of the total population, this is highly underestimated and a very conservative figure. The causes of various impairments are many, and they are based on socioeconomic circumstances and the different provisions that each society makes for the well-being of people with disabilities. Now, different terms are used. You must have heard a lot of different terms used for people with disability. For instance, disabled, handicapped, crippled, physically challenged. These terms, unfortunately, are used interchangeably, indicating noticeably the emphasis on pathological conditions based on the medical model. Actually, people with disability are a very heterogeneous group. They may range from sensory impairment to visual impairment to orthopedic impairment to speech or locomotor impairment, intellectual impairments, learning disabilities, autism and multiple disabilities. The actual extent of disability and the person's environment has a huge impact on the growth and development of the person with disability, and the type of impact on that will depend upon their needs and problems. In India, in terms of incidence, we have highest number of people with locomotor disabilities. Next are people with multiple disabilities, and people with hearing and visual impairments are more or less the same. And this is followed by people with mental illness and mental retardation. The disability experience resulting from interaction of health conditions, personal factors and environmental factors varies greatly from person to person, and that is why this is a very heterogeneous group, as not only it consists of many types of disabilities, but also the impact will vary from person to person depending upon a lot of other factors. Now, the primary impact, of course, and the primary environment for any individual is his family. Now, as you are maybe aware that normally disabled individuals are looked after by their own families. In our country, it's not that people institutionalize people with disability, they actually look after them in their families. However, no family is really prepared for the occurrence of disability in their child, and so when such an event happens, they are shaken to their foundations, and their reactions, the reactions of the family members to the presence of disability in a family member, say a child, will have an effect on each of the family members, including the child or the person with disability. It impacts the presence of disability impacts the family in terms of financial burdens, physical burdens, as well as emotional burdens. Also, the family's characteristics such as composition, mobility, socioeconomic status, stage at which the family life cycle is, all these are, and the reactions that they have to the disabled person will influence the type of problems faced by a family having a disabled person. For instance, if the family is just starting if a couple is just starting their family, and this is the first child who is born with a disability, then the impact and their way of coping will be very different from a person, and in a young person having reached adulthood suddenly gets disabled due to accident or illness. Our next and secondary, though it is a secondary environment, the community also has a great deal of impact on the person with disability as well as his family. Most people, and I'm sure you also realize that most of you, I'm not sure how many of you have had any contact with people with disabilities, and so they're quite ignorant about them. They have very ambiguous and attitude towards them. Sometimes people are sympathetic towards them, at other times they find them distasteful, they do not want to have anything to do with them, and there is a reluctance for direct contact with people with disability. They normally see them from far. Normally, we have seen, say, from a disabled, a blind person, a blind beggar, either in a train or on the road. And so we feel sympathy, we feel sorry for that person, we feel pity for that person. And so all these mistaken stereotypes and misconceptions, there are a lot of misconceptions about them. People believe that they have become disabled because of something that they have done in their past, some mistakes or some misdeeds in their past life, or God is punishing them for something that they may have done. There are a lot of misconceptions like this. So a general public, and I'm sure when you think about a person with disability, you think of the impairment first, whether that person is blind or that person has a locomotor disability. You first think of that characteristic to describe the person. So you say he's a lame person. You don't say a person with an orthopedic disability. So another misconception is that because they are disabled, they don't have any feelings, that they do not, like you and me. And so it often dehumanizes the person with disability, and we almost treat them as objects. Now, these reactions have a very negative effect on the person's experience of his or her disabling condition. I don't know, but you may be surprised that 80% of all disabled persons live in rural areas, and they are quite isolated from society. And if we look at factors which are responsible for this, extreme poverty and illiteracy is one of them. Families having people with disability are often overburdened and impoverished. They live in overcrowded, unhealthy housing conditions. They normally don't have any knowledge of disability, its causes, prevention or treatment. They live in remote areas where medical and related services for preventing or detecting disability or rehabilitation of the disabled population is such services are not there, or they are absent. The geographical distances and the physical and social barriers prevent them from accessing the services in urban areas. They also lack access to education and employment opportunities, and this leads to their economic and social exclusion as well. And this creates a very vicious cycle of poverty and exclusion and disability. If we look at an official definition of a person with disability, I would like to talk about the official definition that is used in the Rights of Persons with Disability Act 2016, which says that a person with disability means a person with a long-term physical, mental, intellectual or sensory impairment which in interaction with barriers hinders his full and effective participation in society equally with others. Now, disability, from this definition you will realize that disability is not that straightforward, it's actually quite complex, it is dynamic and it is also multidimensional. See, it is an outcome of very complex interactions between the functional limitations arising from the person's physical, intellectual or mental disability and the physical environment, the natural and built and environment, as well as the social environment, that is the support and relationships, the attitudes, the services, the systems and the policies that the environment has towards people with disability, as well as personal factors such as motivation and self-esteem. So it is not just that the person is blind or the person is deaf. This impairment of visual impairment or hearing impairment or any other impairment is colored by a lot of other things and conditions in the environment. So it has also multiple dimensions. It's not just an individual health or medical problem, as I was trying to explain. It carries an impact to which which isolates and which creates attitudinal barriers that prevents the person from disability from realizing their potential. People with disabilities are also subject to multiple deprivations. They're likely to be from low-income groups, be illiterate, out of school, much lower employment rate, have much lower employment rates, low awareness of their rights and entitlements. Now, this is not to say that people with disabilities are only born in low socioeconomic backgrounds, but their the socioeconomic conditions are much more impactful for them than just the impairment. So they are actually the largest minority groups which have been vulnerable to neglect, deprivation, segregation and exclusion for centuries. Let's look at, let's take a look at India's disability policy framework. Now, let me tell you what was happening in the initial years. Initially, the Government of India provided measures for prevention and early detection of disabilities. What it did was provided direct financial assistance to the disabled individuals. They also provided and they also established model special education institutions, vocational training centers, employment services. I don't know if you have heard of the special employment exchanges for people with disabilities. And the government was giving grant in aid to NGOs providing educational and vocational training services to people with disabilities. Now these policies and schemes and programs have been largely ad hoc and piecemeal. What I mean by that is that they have not been uniform throughout the country. It really depended upon where the NGOs were and in which states the NGOs were working. So most services, one finds that they are in urban areas, and the services were only for the four categories of disabled: the orthopedically handicapped, the mentally handicapped, the visual handicapped, and the hearing handicapped. So they were not for other disability groups. But then from 1981, there were a lot of global developments in the last 4 decades. And This started with the fact that in 1981, the United Nations declared 1981 as the International Year for the Disabled, and the years 1982 to 1991 was declared as the Decade of the Disabled. The years 1993 to 2002 were declared as the Asia Pacific Decade of the Disabled. And in 2012, UN ESCAP proclaimed the extension of the Asia Pacific Decade of the Disabled and drew up a regional framework for action, which was known as the BIVACO, Millennium Framework for Action, which talked about inclusive, barrier-free and rights-based society for persons with disability in the Asia and Pacific region. The Charter of Human Rights, the Convention of the Rights of Children, and the Convention on the Rights of Persons with Disabilities have highlighted that disability is a human rights issue and have promoted a shift in ideas, ethics, and values. These declarations changed the paradigm from providing only charity and welfare to persons of disability to protecting their rights and promoting their environment. Now, what happened in India? After the 1980s, there were also tremendous changes in the philosophy and provision of services in India too. There was a definite movement away from the concepts of custody, care and treatment to the concepts of prevention, education, rehabilitation, equalization of opportunities and inclusion. We too in India had some landmark judgments were passed by our parliament. The first one, I'm just going to quickly name them because you could read more about them. They are all on the Ministry of Social Justice and Empowerment's website. The Rehabilitation Council of India Act 1992, the Persons with Disability Equal Opportunities Protection of Rights and Full Participation Act of 1995, which was later amended and renamed Rights of Persons with Disability Act 1916, and the National Trust for Welfare of Persons with Autism, Cerebral Palsy, Mental Retardation and Multiple Disabilities, that was passed in 1999. These legislations would not have been passed unless there was a lot of lobby from not only disabled rights activists themselves, but also from the professionals who supported them. The professionals were from all the disciplines who work with people with disabilities. It is now officially accepted that people with disabilities experience inequalities, that they are subject to violation of rights, that they are denied autonomy and dignity, and there is an official recognition that people with disabilities too have a human right to be accepted and be an integral part of society. And it is more the discrimination and not the impairment that disables a person more. Now, this paints a very rosy picture that we have legislations in place. But as happens in every field, there are a lot of challenges in operationalizing these policy frameworks. Now, for one thing, the value system and the perception of the bureaucrats and the professionals of people with disability, that has colored the public policies and social interactions. Now, these professionals, these worthy bureaucrats and professionals still perceive an individual with disability and disability as a personal problem and a tragedy, and that people with disability as very tragic victims. That's why a social policy response to disability has created dependency rather than reduced it. Our infrastructure setup still uses dependency, creating approaches to service provision, and paternalistic language of welfare services have been used rather than rights-based. They still say welfare instead of it's a right for the person to receive education, to receive employment, to receive training And so the main problem is policy ambiguity and inadequate conceptualization of the needs of people with disabilities. So the challenge, what is happening is that government's dependence on NGOs has resulted in sustaining a pattern of segregation. See, what has been happening is, as I said earlier, that the government depends upon the NGOs to provide services to people with disability. Now, these NGOs provide services to specific categories of the disabled. So you would have the Fellowship of the Physically Handicapped, you will have the National Association for the Blind. So they will work with only a particular group that segregates people in a particular having a particular impairment. Now, NGO services are also limited to to urban areas, and there are very few services in the rural areas where, as I said earlier, majority of the disabled people are found. The concentration of most of the NGOs has been on delivery of services, and they have a very technical approach. They would want to give remedial services, give prosthetic aids to, say, orthopedically handicapped person, or hearing aids, or stick to hearing aids to a hearing impaired person. So, or braille paper to people who have a visual handicap. So none of them are really empowering disabled people or lobbying for their rights, and that because that's not on their agenda. In fact, they reinforce the charitable image in their fundraising programs, and they appeal to the emotion of the person, of this poor tragic person, and that is how they try to get funds. Even the community-based rehabilitation programs has also retained the service delivery mode rather than getting the persons with disability to participate in their own program. So this way, disabled people are still denied the right to be treated as fully competent autonomous individuals. So our public policy is such that, and even some of our social service organizations like the Rotaries, the Lions, you must have come across them, how they have these big programs distributing wheelchairs and distributing some of the things that they require for their mobility or for their better hearing aids, for instance, and so that then they can talk about having distributed. So the whole point is that people are more interested in getting their name with the kind of charity that they've done. So this is again, the charity focus has not still gone, and when they are giving these equipment to the people with disabilities, it's more in the mode of welfareism, it's more in the mode of charity. It's not given with the motive that if you give a wheelchair, this person will become more mobile, more independent, be able to do things on his own, will be far more autonomous. Let me not be so pessimistic. In spite of these challenges, we have indeed come a long way. We now have a good base of rehabilitation services, both government and non-governmental, and comprehensive legislation. People with disability are no longer considered as a burden to society and objects of charity. The changing focus on rights of persons with disability, equalization of opportunities, and their true integration in society is now accepted and recognized by all professionals and even the bureaucrats. The challenge before us is to change entrenched stereotypes and negative cultural and ideological mindsets set against people with disability that have affected policy making. India has now to work towards removing disabling barriers and promoting enabling barriers, and for moving towards speaking the language of entitlement, of citizenship for all persons with disability, including for all persons with disability. Then only will we be able to ensure an inclusive, barrier-free and rights-based society for persons with disability. Organizations working with people with disability are now more focused on providing, ensuring that people with disabilities get their rights, to equalize opportunities for them and to integrate them into society. There are quite a few organizations who earlier used to offer segregated services, say for only a particular group, but now offer for the entire gamut of people with disabilities. So, students, what I have done in this subsection is introduced you to people with disabilities and to the context in which they are living, the family as well as the community, the policies which are framed by the policy makers, the point I'm trying to make is that it is not so much the impairment, the visual or hearing or locomotor that really disables the person. It is the attitude of society, the disabling barriers that are created by society that really disables the person. If these socioeconomic political barriers are removed, then only will they be able to enjoy their rights and be a part of our society. I strongly feel that if young people and are able to respect and treat people with disabilities as not different from them, but as somebody who needs a little help and who are otherwise like them, like you and me, then if we set examples, we then will be able to explain to laymen in society that these people are not any different, they are not less than us, they just happen to have a particular impairment because of which they function a little differently. I would like you to look at the legislations I have talked about. Definitely go through them and see what are the clauses. I've also given some other readings which you could look at, which will talk in some depth about some of the socioeconomic factors I have talked about. So, happy reading.